How does Ontario's healthcare system work? Ontario expects to spend more than $80 billion this year on healthcare. What happens with all that money? And where does it even come from? It's really complicated. Let's break it down. Canada has a decentralized, publicly funded, universal health system called Medicare. That means healthcare delivery and funding is primarily the responsibility of the provinces and territories. Each of them has its own public health insurance plan. In Ontario, it's the Ontario Health Insurance Plan, better known as OHIP. The federal government helps the provinces and territories fund healthcare through a variety of programs and agreements, the biggest one being the Canada Health Transfer. But the feds' help comes with strings attached. Getting the full amount is contingent on the provincial and territorial public insurance plans complying with the Canada Health Act of 1984. The Canada Health Act requires that insurance plans have to be universal, publicly administered, comprehensive in coverage conditions, portable across provinces, and accessible. The federal government says that it supports the provinces and territories with around 1/3 of their healthcare costs. So you're wondering, all right, how much of my taxes goes towards healthcare? It's almost 40 cents on every tax dollar. Now, who decides what happens with all that money? Ontario's Ministry of Health. The ministry funnels funding into a variety of programs like long-term care and publicly covered drugs. But do you know what it spends the most money on? Hospitals and OHIP. Currently, 23% of health sector spending goes towards OHIP. That means 6,000 healthcare services are free for Ontarians, like going to your doctor. I'm not a doctor. Ontario's healthcare system is under a lot of pressure. You might have experienced it, the long wait times and the backlogs. These issues existed before the COVID-19 pandemic, but were exacerbated by it. So in 2019, the Ford government ushered in what experts called the biggest health system reform in half a century. It established Ontario Health, this super agency that absorbed the operations of 22 pre-existing agencies. The restructure was pretty controversial, but the Ford government insisted it would improve patient care while cutting costs. Thanks for watching this episode of Nerds on Healthcare. You're now one step closer to understanding the sometimes cloudy realm of our healthcare system. If you like this video, click the like button, subscribe, and click all around me to watch more helpful explainers. I'll see you all in the next video.